Hello everyone. So we will learn about the Inebrients part 2. Okay. In this we will learn about methanol and ethylene glycol. Now what is methyl alcohol? It is also known as wood alcohol or methanol. The rate of oxidation is 1/5 of ethanol. Okay. Now the methanol, it is oxidized by liver into formaldehyde, which is 33 times more toxic than methanol, and then it is further oxidized into formic acid, which is 6 times more toxic than methanol, which is responsible for the associated metabolic acidosis and retinal toxicity. Okay, the fatal dose of methyl alcohol is 60 to 200 ml, and the fatal period is 24 to 36 hours. Now, what is the main important medico-legal aspect? You have all heard about the Hooch tragedy, in which there is accidental poisoning due to consumption of adulterated liquor or bootlegged liquor or homemade liquor which contains methyl alcohol, which is done by lower social economic classes, that results in the mass poisoning. Okay, so this is the main important medico-legal aspect. Now we will learn about the signs and symptoms produced by methanol poisoning. It produces symptoms of drunkenness in same way as ethyl alcohol, but has a less inebriant action. Okay, it causes nausea, vomiting, pain, abdomen, muscular weakness, depressed cardiac action, delirium, and coma. Now, the main important features of methanol poisoning are the visual disturbances such as photophobia, halovision, blurred or misty vision, also called as snowfield vision, concentric diminution of visual fields called as tunnel vision, okay, which is causing temporary or complete blindness due to optic neuritis and atrophy from accumulation of formic acid within the optic nerve. Okay, 10 to 20 ml of methanol can cause blindness. Now, how do you suggest that the person has a methyl alcohol poisoning? If there is severe non-diabetic anionic metabolic acidosis in unconscious person, then it is suggestive of methyl alcohol poisoning. And if there is an increased osmolar gap accompanied by visual symptoms, then it suggests methyl poisoning. Okay, it is very important in casualty. The treatment part of methyl alcohol poisoning. Now, gastric lavage is done using 5% bicarbonate and 500 ml is left in stomach. Activated charcoal reduces mortality significantly. Okay. Now, ethanol is the antidote for methyl alcohol poisoning. It is a competitive antagonist. Okay. It has a much higher affinity for alcohol dehydrogenase than the methanol. In methyl alcohol poisoning, ethyl alcohol by competition for catalase. Catalase is an enzyme which forms formic acid from methanol. Okay. It blocks the formation of formaldehyde and allows the less toxic methyl alcohol to be excreted and metabolized. Now, hemodialysis, it is the treatment of choice in severe poisoning. Okay, and 4-methylpyrazole or fomepizole, it is a competitive inhibitor of alcohol dehydrogenase. Okay, it blocks the formation of formaldehyde and formic acid and can be used instead of ethanol. Now we will learn about ethylene glycol poisoning. Okay, it is a major constituent of antifreeze solution. The toxic metabolites are glycolic acid and oxalic acid. Okay, the ethylene glycol, it itself is not toxic. Okay, it inhibits oxidative phosphorylation. The fatal dose is 100 to 200 ml. Fatal period is 3 days. Now we will discuss about the signs and symptoms. Okay, there are CNS symptoms which usually develop within half hour to 12 hours after ingestion. The individual develops nausea, vomiting, severe headache, delusion, convulsions, and coma. Now there is also acute tubular necrosis and oxalate crystals are also seen in urine. This is all about ethylene glycol poisoning.